Welcome to our video on diabetes, a condition that affects millions of people worldwide. In this video, we'll explore what diabetes is, its different types, causes, and how it can be managed effectively. You'll learn about the signs and symptoms of diabetes, as well as the importance of early diagnosis. We'll discuss the critical role of healthcare providers and diabetes specialists in helping individuals lead healthier lives. Diet and nutrition play a vital role in managing diabetes, and we'll share practical tips on making healthier food choices. Regular physical activity is another key component of diabetes management. We'll explore exercise routines tailored to your needs. Medications and insulin therapy can be crucial for some, and we'll explain how these treatments work. We'll also dive into monitoring techniques, like A1C tests and continuous glucose monitoring, that help maintain stable blood sugar levels. Whether you have diabetes or want to learn more to support a loved one, this video is your guide to understanding and effectively managing this condition. Let's begin our journey into the world of diabetes. Together, we'll empower health and promote a brighter future. Diabetes is a chronic medical condition that affects how your body regulates blood sugar glucose. There are two main types of diabetes. Type 1 diabetes. This is an autoimmune disease where the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body can't regulate blood sugar levels, leading to high glucose levels. People with type 1 diabetes require insulin injections or an insulin pump to manage their blood sugar. Type 2 diabetes. This is the most common form of diabetes and is often associated with lifestyle factors like poor diet, lack of physical activity, and genetics. In type 2 diabetes, the body either doesn't produce enough insulin or becomes resistant to its effects. It can often be managed with lifestyle changes, oral medications, or insulin if necessary. Both types of diabetes can lead to serious health complications if not managed properly. Complications can include heart disease, kidney problems, vision issues, and nerve damage. Regular monitoring of blood sugar levels, a healthy diet, exercise, and medications is prescribed by a healthcare provider are key components of diabetes management. The signs and symptoms of diabetes can vary depending on the type of diabetes in the individual. Here are common signs and symptoms associated with diabetes. Common symptoms for type 1 and type 2 diabetes. Number 1. Frequent urination. Excess sugar in the blood leads to increased urination as the body tries to eliminate the excess glucose. Number 2. Excessive thirst. Frequent urination can lead to dehydration, causing increased thirst. Number 3. Unexplained weight loss. Despite eating more, people with diabetes may lose weight due to the body's inability to use glucose for energy. Number 4. Fatigue. A lack of energy can be caused by the body's inability to effectively use glucose for fuel. Number 5. Blurred vision. High blood sugar levels can cause changes in the shape of the lens of the eye, leading to temporary vision problems. Number 6. Slow healing of wounds. High blood sugar can impair the body's ability to heal cuts and sores. Additional symptoms more common in type 2 diabetes. Number 1. Frequent infections. Individuals with type 2 diabetes may be more susceptible to infections, particularly of the skin, urinary tract, or gums. Number 2. Tingling or numbness. Nerve damage neuropathy can cause tingling, numbness, or pain, usually in the hands and feet. Number 3. Increased hunger. Despite eating, some people with type 2 diabetes may experience persistent hunger. Symptoms of diabetic ketoacidosis (DKA) in type 1 diabetes. Diabetic ketoacidosis is a severe complication of uncontrolled type 1 diabetes and is characterized by the following symptoms. Number 1. Nausea and vomiting. These symptoms are often accompanied by a fruity odor on the breath. Number 2. Deep, labored breathing. Known as Kussmaul breathing, it's the body's attempt to compensate for acidosis. Number 3. Confusion or altered mental state. DKA can affect the brain's function. It's important to note that some people with diabetes, particularly those with type 2 diabetes, may have no noticeable symptoms, or their symptoms may develop gradually. This is why regular checkups and blood sugar monitoring are essential, especially for individuals at risk of diabetes due to family history, age, or other factors. If you experience any of these symptoms or suspect you may have diabetes, it's crucial to seek medical evaluation and diagnosis for appropriate management and treatment. Managing and treating diabetes involves various strategies, depending on the type of diabetes and individual needs. Here are some key approaches. Number 1. Lifestyle changes. First, diet. Follow a balanced and healthy diet. Focus on controlling portion sizes, consuming whole grains, lean proteins, and plenty of fruits and vegetables. Limit intake of sugary and high-carb foods. Second, exercise. Regular physical activity helps control blood sugar levels. Aim for at least 150 minutes of moderate intensity exercise per week. Third, weight management. Achieving and maintaining a healthy weight can improve insulin sensitivity, especially in type 2 diabetes. Number 2. Medications. In type 1 diabetes, insulin therapy is essential. Multiple types of insulin are available, and the treatment plan is individualized. Education. Learn about diabetes, its management, and how to recognize and respond to higher low blood sugar levels. While in type 2 diabetes, depending on the severity and progression of the condition, oral medications, injectable medications, or insulin may be prescribed. Number 3. Blood sugar monitoring. Regularly check your blood sugar levels as recommended by your healthcare provider. This helps you make necessary adjustments to your treatment plan. Number 4. Education. Learn about diabetes, its management, and how to recognize and respond to higher low blood sugar levels. Number 5. Regular medical checkups. Visit your healthcare provider regularly for checkups and to assess your diabetes management plan. Number 6. Complication prevention. Take steps to prevent or manage complications, including heart disease, kidney problems, eye issues, and nerve damage. Number 7. Stress management. High stress can affect blood sugar levels. Learn stress reduction techniques like deep breathing, meditation, or yoga. Number 8. Support. Join a diabetes support group or seek support from friends and family. Managing diabetes can be challenging, and a support system can be valuable. Number 9. Smoking cessation. If you smoke, quitting can significantly reduce the risk of diabetes-related complications. Remember that diabetes management is highly individualized, and it's crucial to work closely with your healthcare team to develop a treatment plan tailored to your specific needs and circumstances. Smoking can have several detrimental effects on diabetes, particularly in individuals with type 2 diabetes or those at risk of developing diabetes. Here's how smoking can impact the severity of diabetes. Number 1. Increased insulin resistance. Smoking can lead to insulin resistance, a condition in which the body's cells don't respond effectively to insulin. In people with type 2 diabetes, insulin resistance is already a problem, and smoking can worsen it. This makes it more challenging to control blood sugar levels. Number 2. Worsening of cardiovascular risk. Diabetes is a risk factor for cardiovascular disease. Smoking compounds this risk by damaging blood vessels, increasing blood pressure, and promoting the buildup of fatty deposits in the arteries. This can lead to more severe heart-related complications in individuals with diabetes. Number 3. Blood sugar control. Smoking can make it harder to manage blood sugar levels, as it can lead to erratic fluctuations. Nicotine and other chemicals in cigarettes can cause an immediate increase in blood sugar levels, but over time, they can contribute to long-term instability. Number 4. Increased risk of diabetes complications. Smoking raises the risk of diabetes-related complications, including heart disease, stroke, kidney problems, nerve damage, and vision issues. These complications can be more severe and progress more rapidly in smokers with diabetes. Number 5. Reduced response to medications. Smokers with diabetes may have a reduced response to certain medications used to manage blood sugar levels. This means that they might need higher doses or additional treatments to achieve effective control. Number 6. Wound healing. Smoking impairs the body's ability to heal wounds and fight infections. In people with diabetes, this can be particularly problematic, as they are already at risk for slow-healing wounds, which can lead to more severe complications, such as ulcers and amputations. Given these negative effects, it is strongly advisable for individuals with diabetes or at risk of diabetes to quit smoking. Quitting smoking can lead to significant improvements in blood sugar control, a reduction in the risk of complications, and an overall improvement in health. Support from healthcare providers and smoking cessation programs can be invaluable for those looking to quit. Thanks for tuning in to learn more about diabetes. Remember, knowledge is a powerful tool in managing your health. Stay informed, make wise lifestyle choices, and prioritize your well-being. Together, we can raise awareness and promote a healthier future. Take care.